Hello everyone, I'm Dr. Kanchan. Welcome to my YouTube channel. If you've been here before, you would have seen my part 1 FRC path preparation video, but this video is no sequel to it. I'm making this video on popular demand. This video is about the various routes through which you can get into UK and start working as a pathologist. And also I'm making this because I believe that before you start taking any exams, if you know all your options that are there on the table, you can choose better for yourself which pathway suits you the most. So without any further delay, let's talk about it. So majorly there are 3 pathways through which you can enter UK, and eventually all these pathways lead to GMC registration, which is essential for you to work as a pathologist in UK or as any other doctor. So there are 3 routes. I'll be discussing about all 3, but I'll be discussing more in details about the PLAB route because that is something which I have done. So let's start with talking about the first route, which is the FRC pathway. We all are aware of the FRC path exam. We've had the discussion before. So according to me, this is obviously the best route for you to go to UK as a pathologist. So if you are at the stage of your career in which you have enough exposure and enough experience to start working independently as a consultant in a new country, then that is the best thing. You have to just clear the exam. The exam part is the difficult part. After that, everything is pretty simple, pretty easy, because there are so many jobs available for consultant histopathologists. There's a huge dearth of pathologists in UK, and once you clear the exam, which is the difficult part, then it's a simple ride for you from there on. Unfortunately, I have not done my part 2 yet, so I cannot guide you with the preparation part, but I'm pretty sure there are so many online groups and conferences which can help you. So if you are somebody who's confident enough in your career, so go ahead. This is the best route. If not, then let's talk about the rest 2 routes. The second route is quite an interesting one. It's called the sponsorship route. I didn't know about this route until recently. Essentially, it's kind of complicated because there's a lot of paperwork involved. Why? Because basically for the sponsorship route, you are not taking any exam. That is the biggest advantage. You're not taking PLAB, you're not taking FRC path. Without doing the exams also, you can get a GMC registration through sponsorship, through a trust which is sponsoring you from whatever your country is to, and call you to UK and give you a GMC registration. That will give you a very good starting point to start your career in UK, but eventually obviously you'll have to take the FRC path exam to become a consultant. With sponsorship route, you will get a job or a position which is less than a consultant, but it will give you it will basically kickstart your career in UK. But again, I have not done it, so I'm not qualified enough to tell you about the details of the route. It's quite complicated, like I mentioned. When I read about the guidelines, I thought I was not eligible, so I did not go into it any deeper. But if any one of you is interested, you should definitely go to RC Path website and check out their guidelines. They have given a detailed approach of how you can apply for this route. And like I said, the biggest advantage is you don't have to take any exams initially. That is about it, and you should check it out, is what I'll suggest. So this is about the sponsorship route. The third route is the one that I am going to discuss more in detail, which is the PLAB route. So yes, I took PLAB exam, and I was able to finish both the parts, part 1 and part 2, in 3 months, and get my GMC registration. So the reason also why I wanted to discuss about PLAB is because especially in non-clinical branches like pathology, people have a reservation against taking this exam. They have a reluctance owing to the fact that, one, you have to go back to all the subjects and read it again? Yes. And the second part is, we are not clinicians, we are not seeing patients from a long time, so will I be able to do it? There's always a question mark. This is why I want to tell you that firstly, it is definitely possible, and secondly, it is easy, right? So PLAB route, according to me, is the easiest amongst the three routes that we have discussed. Easy. Why? Because yes, you will say, I have to go read all the subjects again, but believe me, it's actually very basic exam, because it's actually a post MBBS exam, post graduation exam, so they are not expecting much out of you, right? So let's discuss about part 1 and part 2. It's divided into two parts. PLAB 1 happens 4 times a year. It's a MCQ based exam, but you don't compare it to the MCQs of FRC Path part 1, because it's a specialty exam. It's way more difficult. For part 1 PLAB, what I did was, I went and subscribed to this thing called PLABable, which is one of the most popular tools for passing the PLAB exam. It's a subscription based question bank. So I subscribed for 3 months, did PLABable twice, and apart from that, I went to the Facebook groups. There is a lot of free material that's available in all the Facebook groups, so you can go to anyone and check the file section. There will be all the free material that you can imagine. So I actually had 3 weeks, just 3 weeks to prepare for the exam, but I would highly recommend taking 2 months out at least. And then in 2 months, it will be easy for you to get it done. Read PLABable maybe twice, and after that just do the extra free material how much ever you can. It's very simple, very basic. Yeah, you will have to go back to the to anatomy and physiology, but I mean, I'm pretty sure it's a basic level, so you can easily do it. So that's about PLAB 1. About PLAB 2, people are way more hesitant about PLAB 2, especially non-clinical people, pathologists, because yes, PLAB 2 exam involves 20 scenarios in which you have to deal directly with 20 different patients in 20 different scenes and clinical scenarios basically. So even initially I was also jittery about part 2 exam, but retrospectively I can tell you that part 2, not part 1, but the part 2 PLAB exam has been the easiest exam that I have ever given in my medical life, and this is no exaggeration. So I did have some advantages because I was in UK, and what I did was, after I took dates for PLAB 2 exam, I also enrolled myself to these PLAB coaching classes, and I won't recommend any one name for PLAB coaching classes because all of them are good and they all are doing the same job and very good job. What they do is they spoon feed you basically, and I didn't know anything about the preparation of PLAB 2 exam before I went to the classes. Once I went to the classes, they took care of everything from there on. They taught me, they took our tests, mock exams, they gave us the study material, so I did not have to worry about anything. So PLAB 2 exam is basically all about your communication skills, and if you're good in your communication skills, your command over language, empathy with the patients, then that's it, you're sorted. It is not about your medical knowledge. They will not be expecting a lot. You're just a MBBS pass out graduate according to them during the exam, so they don't expect you to know the treatments, the doses. No. So I mean, if you're having reservations thinking that about these things, then I can assure you, I am a pathologist. I have not done clinical work in the last 10 years, but I mean, I was easily able to do it. So the best thing is, if you can join an academy, they will be able to take care of it all in all for you. If you cannot, let's say you cannot come to UK, then you have the option of either joining online courses, online coaching, or some people even do it without joining coaching, but I would not recommend it myself. I would say that it's better if you join some kind of coaching, because they know how to point you in the right direction. So once you do these coaching, you have to practice. You have to practice a lot. If you're going in the coaching classes, you'll find your friends, your colleagues who are there, who you can practice with. If you're doing online, then you'll have to find partners who you can practice with online. And unlike in real life, for PLAB, getting partners is very easy. You just put it on Facebook or any WhatsApp groups, and there'll be a lot of people who will be ready to practice with you. You can practice with multiple people these scenarios. So essentially, this video is actually not about the PLAB preparation, because there's a lot more to it. And if you would like, I can make another video for just PLAB preparation. But there's plenty there on the internet. You just Google or YouTube, Facebook, you'll get a lot of data that is there for the preparation of the exam. But this exam is this video is mainly for you to remove the hesitancy that since you are not a clinician or you are a specialist, you cannot go back to these subjects. You can very easily, very well. And that is all I want to say, that if the other two routes don't work out for you, or if you're looking for an easy way to get into UK, PLAB route is the one that you could consider, right? If you have never thought about this before, you can now take some time out and do some research and think about it. Apart from that, there's a lot to actually the preparation part of it, but all I would say is I was able to do it in 3 months, and the maximum time that it would take is maybe 5-6 months, and that's it. You're sorted. You'll get your GMC registration. As per me, at this stage at my career, I was not confident enough to start working independently in as a consultant. So I took this route. So once you pass the PLAB exam, like I did, I got my GMC registration, and very soon I'll start working as a registrar or as a clinical fellow, or at a post which is less than the consultant post. So I will be doing it for a year or so. This is to give me the exposure into the UK system in general, and also more histopathology exposure. So this is going to be like a bridge between like a 1-year bridge between my part 1 and my part 2 exam, in which I'm getting experience, which will help me immensely during my part 2 preparation, increase my chances of passing in the first attempt. So this is the route that I chose, because I found that that is what best suited me, and it could actually best suit a lot of other people also. But like I said, people don't consider this, because PLAB is supposed, they think that PLAB is a very difficult exam, which is not true. So yes, these are the 3 routes that you can take for getting a registration in UK. And of course, with all these, you have to do IELTS, which is again an English exam, which you have to do before your PLAB exam. You have to take IELTS, or after FRC Path, you can do IELTS. That is one additional thing. So yeah, that's about it. If you have any other queries about PLAB or any other route, you can put it in the comment section below. I will try to answer. And if there are any more videos, any more topics that you want me to make a video upon, I would be happy to help. You let me know. And I would just say all the best to all of you in whatever ventures you're doing in your life, in your professional and personal life. And I would like to hear from you if this helped. So thank you and take care. Bye-bye.